Hi there, today I'm going to be talking about autism and autism spectrum disorder. So autism spectrum disorder is a developmental disability that can cause significant social, cognitive, and behavioral changes. The term spectrum refers to the wide range of symptoms, skills, and levels of impairment that people with ASD can have. The symptoms of ASD can range from mild to severe and usually have to do with difficulty in social interaction. The signs of ASD begin in early childhood, usually in the first 2 years of life. So oftentimes you won't really find someone with ASD diagnosed until about 2 or 3 years old. That's when they'll start to show developmental delays in social interaction and even language delays. So children with ASD often seem to exist in a private world in which they have limited ability to successfully communicate and interact with others. Children with ASD may have difficulty developing language skills and understanding what others say to them. And they also have difficulty in communicating non-verbally, such as through hand gestures, eye movement, and facial expressions. So that can be really prevalent. A lot of times the main thing you find with someone with ASD is just a language impairment in any sort of way. That's kind of the first indication of it. Some children with ASD may not be able to communicate using speech or language, and some may have very limited speaking skills, and others may have a rich vocabulary and be able to talk about specific subjects. So it really just ranges. So some kids with ASD may not be able to communicate until using speech and language, and some may have very limited speech and language, and some really can have the best speech and language of any other person. It really just depends on how severely disabled they are with ASD. So that's kind of a hard indicator because some kids may not be able to say any sentences, say any words at all, be totally mute, where others can totally, you have a conversation with them and you might notice a couple things off, but you can totally hold a conversation with them just fine. And some language patterns that can be found in children with ASD are rigid and repetitive language. So what that means is they'll just kind of talk about one thing over and over again, whether it be like something you saw a minute ago or whatever, and then it can totally be off topic. They'll just have that one track thing in their head and keep on talking about it. Narrow interests and exceptional abilities. So that what that means is like they only have an interest in talking about one certain specific thing, and they'll only kind of just really like focus on that. And then exceptional abilities means that they might not be able to hold a conversation, but then they'll be, total brainiacs in mathematics and totally be better than everyone else. So it just kind of depends on what, sector of language they're kind of faulting in. Where uneven language development, that's a huge one as well. So that means like in certain cues, they're very advanced in, so say like animals, they're very advanced in knowing different names of different animals, where hellos and goodbyes are not very good in. So like, the person may use like hello and goodbye, very inappropriately, like use it in situations that doesn't need to be used, where cat, dog, they have that down. Poor nonverbal conversation skills, that's one huge thing with ASD. It's just meaning that like basically they can't really like know when to use certain hand gestures, so like rolling their eyes, they may use that in like a happy scenario. So like they may be really happy and excited and they might roll their eyes, where normally in like regular kind of body language, that's like, saying a sign of you're upset or you're frustrated. So it's just kind of things like that where they're just not knowing how to non-verbally communicate. Parents can really help to integrate an improvement in their child's language ability. The first therapy recommended for a child with ASD is speech-language pathologist. As a speech-language pathologist, this is a health professional trained to treat individuals with voice, speech, and language disorders. The speech-language pathologist will perform a comprehensive evaluation of the child's ability to communicate and will design an appropriate treatment program. So this person will go in, and it's a therapy like anything else. They'll go in, they'll kind of see an assessment of how your child is doing, and they'll just say, okay, we're going to put you on this track and we're going to work on these certain things depending on what your child is struggling with. So if it's social interaction, it could be more sensed around like, certain, daily activities that the child's doing often, and kind of know how to, guide them through like conversation within that and how to do language throughout that. Teaching children with ASD to improve their communication skills is essential for helping them reach their full potential. So language is just really how the world communicates, whether it be sign language, whether it be verbal language. It's kind of how we all interact. So it's very essential for your child to learn any form of communication, whether that be verbal or nonverbal. Parents and caregivers can increase a child's chance of reaching this goal by paying attention to his or her language developmentally early on. So a parent, as soon as your child is diagnosed with some form of ASD, it's very important to take early integration and take care of that and get them into therapy or start working with them on certain vocal cues where a normal child you wouldn't work as hard and with. So it's really important, and it depends really on the parent's guidance for the child on how they're going to develop. Some children with ASD may never develop oral speech and language skills. For these children, the goal may be learning communication using gestures such as sign language. So like I previously mentioned, it's very important to have some form of communication. So from a lot of children with very severe ASD, sign language is a great alternative, or even like sign cues where they hold up certain signs, or if they write on a board, whether they're good at written language. Those are just great options for children that are really struggling with, total vocal delivery. Make sure to constantly talk to your child and practice speech using flashcards and games recommended by therapists. So it's really important to take anything your child's learning and using in therapy and bring that home with them and really practice that 24/7 as much as you can. And, make it fun for the child, use games, use flashcards, just make it kind of interactive for them. Technology currently makes it easier than it's ever been to establish a form of communication for your child or to help them improve their skills. iPads are a huge improvement in technology for your child to learn a very interactive game having to do with language or whatever it may be. It's a very easy way for every parent and every household to kind of be able to integrate certain language activities and certain therapies at home. The most important form of integration a parent can give to their child with autism is making them feel loved and spoken for, especially when they're not able to themselves. So it's really important for your child just to not feel different and to feel like, even though they may be different in some instances, to make them feel like they are the same in the sense that they can communicate. They are totally mentally capable to communicate in some certain way, and just don't hold them back from that. Make sure to bring that out in them, make them feel loved, make them feel wanted, and make them just really want to shine and feel like they, are able to be part of a society. Where a lot of parents kind of tend to, brush them to the side or, act like they're special. It's very beneficial to not do that. Make them feel the same as everyone else. So thank you. I hope this helps any parents with children with ASD or newly diagnosed, and hope you guys have a great rest of your day. Thank you.